In the last session, Dr. Perrell talked about some of the lifestyle changes that you can make to improve control of your atrial fibrillation. I'm now going to talk about some of the procedures that you may have to also help control of your atrial fibrillation. So the first procedure that a lot of people have is a cardioversion procedure. This procedure involves effectively resetting the heart rhythm, getting rid of atrial fibrillation and allowing the normal rhythm to come back. It doesn't do anything about the long-term control of atrial fibrillation, but for people who are really feeling it and who are really symptomatic, it's really effective at getting rid of the atrial fibrillation and resetting things cross-sectionally. A cardioversion is generally done as a day case. We also do it for inpatients. It typically involves a light general anaesthetic. You've got to make sure that you're on a blood thinner. There'll often be an ultrasound of the heart to make sure that there's no blood clot inside the heart at the beginning of the procedure, and that often involves a tube that you effectively swallow. After that, you'll see it on TV, usually with some paddles or some patches. There's effectively an electric shock across your chest to reset the electrical activity of the heart. It's done under a light general anaesthetic, so you don't feel it and it's not painful. So after a couple of hours, when you've woken up from the anaesthetic, you can go home. You need someone to drive you. You shouldn't drive for 24 hours, but you're back in a normal rhythm and feeling well. Another procedure that you may have is known as an AF ablation procedure. An ablation procedure is the most effective long-term way of controlling your atrial fibrillation, keeping you in a normal rhythm and keeping well. We know that for the vast majority of people with atrial fibrillation, episodes of atrial fibrillation are triggered by fast electrical activity that gets into the heart, into the atrium, from structures known as the pulmonary veins. They're the big veins that drain blood back into the heart from the lungs, and for reasons we don't fully know, they serve as the source of AF episodes in the vast majority of patients. So what we do in an AF ablation procedure is to try and electrically isolate those veins. We try and take them out of the picture and electrically disconnect them from the heart. It doesn't do anything about impairing the blood flow back to the heart, it's purely an electrical procedure. What we're trying to do is create a ring of scar tissue around the origin of those veins, and that scar tissue effectively acts as a barrier, a block to those triggers for episodes of AF getting into the heart. We can do that either by burning or freezing tissue in a very defined and limited fashion around the origin of those veins. All the evidence shows that either burning or freezing have basically the same outcomes and basically the same risk profile. The people we know who really get benefit from AF ablation are people who are symptomatic, people who are feeling their atrial fibrillation. Now, one option for that sort of patient is to be on medications, but the other option is an AF ablation procedure. And sometimes those two things need to be combined. We've got very clear evidence to show that an AF ablation procedure is the best way of controlling the atrial fibrillation and of staying in a normal rhythm long term. The real benefit of that is that you'll feel better. Your symptom status and quality of life will be better. We don't have a lot of evidence that an AF ablation procedure changes your stroke risk. It shouldn't be seen as a way of coming off blood thinners, but it clearly makes people feel better. In general, it's probably best to have an AF ablation relatively early in the course of your AF journey. We know that the longer you've had the AF, the harder it does become to control. It doesn't mean that it's impossible, but in general it's better to have it early because you'll get a better outcome. When it comes to controlling AF, it's very much an individual decision whether you prefer to try antiarrhythmic medications or to try an AF ablation procedure. There's no hard and fast rule, you get to decide. The advantage of medications is that it avoids the procedural complications. The downside of medications is that it's overall not as effective, there may be side effects, and you may have to be on the medications for a longer period of time. The advantage of the AF ablation procedure is that it is more effective, and it potentially avoids the need to be on medications long term. After an AF ablation procedure, the likelihood of being in a normal rhythm and basically having no AF for at least a few years is around 70%. There's some variation in that in terms of how long you've had the AF and how your heart's working, but it's about 70%. We do know that if your AF does come back, then a lot of patients also then benefit from having a second procedure. We know that that increases the overall effectiveness of the whole process. In our practice, AF ablations are routinely done under a general anaesthetic, and usually patients are admitted to the hospital for 1, maybe sometimes 2 nights. In our practice, an AF ablation procedure is overwhelmingly done under a general anaesthetic. Regardless of whether we're using a freezing technology or a burning technology, the procedure is not an open heart procedure. It involves a number of tubes being put into the veins in the groin, either one groin or both sides. The electrical wires are passed up into the heart, and using those wires we do either the freezing or the burning. Sometimes you'll have an ultrasound probe passed down your throat so we can see the heart from behind, and sometimes you'll have an ultrasound probe passed up into the heart through the veins in the groin. These ultrasounds increase the overall effectiveness and certainly the safety of the procedure. Patients are typically in hospital for 1 night and they can usually go home the next day. We do ask people to be pretty careful for the next week, to let the sites where they had the tubes put in to heal up nice and strongly. After a week you can get back to all your normal activities. It's really important to remember that all the lifestyle factors that Dr. Perrell discussed, exercise and weight loss and alcohol moderation, have clearly been shown to improve the overall effectiveness of your ablation procedure. One of the key things in managing your atrial fibrillation is reducing your stroke risk. For most people, that involves blood thinners of various forms. Historically warfarin, more often other forms of drugs now that don't need blood tests to monitor their effect. For some people, particularly people who've had issues with bleeding on the new generation blood thinners, there is an alternative that involves a small device being placed into the heart into something called the left atrial appendage. The left atrial appendage is a small outpouching from the heart, and it tends to be where the blood clots develop that then actually cause the stroke. By putting a small umbrella or a small plug into that outpouching, that's another way of minimizing your risk of having a stroke. Like with an ablation procedure, it involves a general anesthetic, it involves tubes in the vein in the groin, and it involves wires being passed up into the heart. In people who've had problems with bleeding, we've now got pretty good data to show that this sort of left atrial appendage occlusion device is basically as effective as the blood thinners are for reducing stroke. Another procedure that at some stage you may need is having a pacemaker implanted. A pacemaker is a device which stops your heart going slow, and that can be needed over time, often as people get older, when the heart starts to slow down and then that causes symptoms. It's important to realise, however, that having the pacemaker doesn't actually fix the atrial fibrillation. That's what we do with medications and ablation procedures. This is the last in our video series about atrial fibrillation. We hope you found it useful to understand some more. We look forward to seeing you in person and working with you to manage your atrial fibrillation.